The monkeypox outbreak is spreading nationwide. Nearly every state in the U.S., including Maryland, has reported at least one case of the virus.
So we have at least 53 cases. Honestly, that number seems to increase daily.
Howard has a little less than a handful of cases.
The nationwide rate of new cases outpaces the current federal vaccine supply, which has the federal government implementing a new prevention strategy.
The agency began exploring viable scientific options that would allow for greater access to the currently available vaccine.
This morning on 11 TV Hill, what you need to know about monkeypox. And hello everyone, I'm Jason Newton. Welcome to 11 TV Hill. Monkeypox is officially a public health emergency here in the United States. With cases in every state, as you heard, except for Wyoming, containing the virus, it is the focus for health officials. As of Friday, CDC data shows the U.S. is nearing 11,000 confirmed monkeypox cases. Of those, Maryland has reported 259 infections. Several Maryland colleges, including the University of Maryland, are now monitoring the outbreak ahead of the start of the academic year. But there are still many questions when it comes to who is most at risk, the virus's transmission, and vaccine access. And joining us this morning is Baltimore City Health Commissioner Dr. Letitia Draza and Howard County Health Officer Dr. Mara Rossman. Thank you both for joining us. We appreciate it.
Absolutely.
Thank you for having us.
Certainly. Let's just start with a status update as far as monkeypox goes. And we'll start in the city first. What are you noticing right now here in Baltimore?
So we have at least 53 cases. Honestly, that number seems to increase daily. And that's of the state's 219 cases. So we're continuing to provide education and outreach and do canvassing to higher risk areas.
Howard has a little less than a handful of cases, and similar to Baltimore City, doing education, outreach. We also provide testing and vaccine, and working with our community providers to enable them to be able to evaluate, diagnose, and treat as well.
So I'll be real with you. If I'm a viewer and I'm watching this right now and I hear numbers that low, my curiosity is, for an average person, should I be concerned? I think as someone who reads the headlines a lot, I think, yeah, you should be. But from a health director, what do you ladies think? For the average person, what kind of precautions should there be right now?
Yeah, maybe I'll start, and I know Dr. Rossman will chime in. I will still say, based on what we're seeing, that prevention is key. It's still the cases that we are seeing still tend to be in men mostly. That echoes the epi data that we're seeing across the country, and it tends to be in men who have sex with men. And so I think that the key takeaway for people is prevention, right? So thinking back to early days of COVID, what are some things that you can do to prevent transmission? One of those things may be engaging in safer sex. So, limiting the number of sexual partners, or if someone has a rash and they're not sure what it is, avoiding that close skin to skin contact, certainly avoiding objects or materials someone with an unknown rash may have touched. And as Mara mentioned, getting tested, right? And most providers do have some capacity to test. So if you have a rash and you're not sure what it is, call your provider and ask them if they have the capacity to test you.
Yeah, I just have a little bit to add to that. I think the question really is, should you be educated and knowledgeable about what's going on? And the answer is yes. And we're here as public health experts and officials to share the information that we have so we can empower our residents to know what's going on and what they can do. And yes, as was previously stated, over 98% of the cases are in men, and men who have sex with men. And the transmission mostly is through direct skin-to-skin contact or by sharing clothes that have been exposed. And so the information is that right now seems to be in a certain population. We would like to continue to contain this infection so it doesn't spread beyond where it is. And the way we can do that is with prevention, as was stated, and also with vaccine that we have now and will soon hopefully have more of, to be able to provide pre-exposure prophylaxis.
Yeah, and Dr. Rossman, I'll get you to keep with this because you mentioned some of this. Just because the infection is focused in a population, it seems, it is not limited to men who have sex with men. And I'm hoping you can explain that some, because it seems like this is something that can be passed skin to skin, the sheets on your bed. It sounds like it stays on surfaces for a bit.
Well, again, the transmission mostly is through the infected lesions that you get. So you have to have the direct skin-to-skin contact, or the vesicles may have gotten on the sheets. And yes, right now it seems to be mostly men who have sex with men who are engaging in activities, right, that make that happen. And it can, but this disease is not limited to men who have sex with men, so it can spread to anyone. And that's why we're working really hard to get the word out to the entire community about what they can do to understand what's going on and take the proper precautions.
Sure. Dr. Draza, talk to me a little bit about vaccines. I guess the number, when I heard 3,200 through an entire state, I just thought, wow, that's not going to last long. I think you raced through here in the city. What do you make of that number? And today, as we're recording this, they talked about splitting doses, so you can use a smaller amount for more people. What do you make of what's on hand, and what's the urgency to get more?
Yeah, well, I'll maybe talk about what you mentioned briefly about the splitting doses. So the FDA yesterday did approve a change in how the dose is administered, which would allow for some expansion of the current vaccine supply, which, as you stated, is extremely limited for our state and for the jurisdictions. And so the way that we're thinking about who is eligible for vaccine supply is based on what the CDC has outlined. It really is, those individuals who have been identified as close contacts of a confirmed positive case, individuals who have exposure through their occupation. So those healthcare workers that are handling monkeypox testing materials. And we also have expanded that per what we call expanded post-exposure prophylaxis to individuals who they believe they came in contact with someone who had a case of monkeypox. That said, as you know, vaccine is limited. And so what we're focused on in the city is really an equitable approach with the limited number of vaccines that we have. So we're always going to maintain a certain level of vaccines for individuals who could be close contacts as we're doing our case investigation and contact tracing and determine who those folks are. We'll have some for healthcare workers. And then we're being very focused on groups that are higher risk to set aside vaccines for that group as well. But I think this is where I think prevention and education also becomes key until we have an expanded supply of vaccines, really being informed and making the decisions that you have to make to protect yourself.
Sure. Dr. Rossman, about 30 seconds left, so I'll give you the last word here. If you're someone and you're concerned, or you feel like you may be in this population where this could be keyed in on you, what are my next steps at this point?
I would contact your usual provider to see if you're eligible for any of the post-exposure or pre-exposure vaccine that is in limited supply. I encourage you can go to your local website for your for your local health department and find out more about monkeypox and transmission and how you can protect yourself.
All right, ladies, doctors, thank you so much for your time today. We appreciate it.
Thank you.
Thank you.
The CDC released guidance for those who test positive for monkeypox. Anyone with a rash should isolate until their rash is fully healed. That includes isolating from even your pets. Those who need to go out should cover their rash. The CDC advises those with monkeypox to avoid sharing utensils, cups, and clothing.